name's Kyle Lowe. I'm an orthopedic surgeon. So I did my medical school at Harvard, and then I went to Johns Hopkins for my residency. And then after that I did 2 fellowships, one in Kansas City, where I got to spend some time with the Kansas City Chiefs. And after that I did some time in New York to do my foot and ankle fellowship. If you have a specific sports-related problem or foot and ankle problem, then I'd be the person to come to. I've always wanted to be a doctor, ever since from my first pediatric visit when I was a child. I just thought it was kind of cool. You kind of go into the offices and you get all these toys to play with, and at that point everything was a toy, so I thought it was interesting, and then that's what I decided to do. So maybe that's why I do orthopedics too. There's a lot of gadgets and little things to play with. Seeing patients, helping people, getting in the operating room, working with my hands, working with tools. It's all fun. I think it's always great to develop a rapport with your patients, and I think through that you can get better communication, and there's more of a trust there. Once I examine the patient, we try to do as much as I can. Even though I'm a surgeon, I try to treat them as non-operatively as possible. If I can get them through with non-operative treatments, meaning therapies or medicines or injections, and if I can get them through with non-operative treatment, then great. But if I have to, then I would usually use surgery as a kind of a last resort, so to speak. I was raised right over the hill in Hacienda Heights. Well, I was pretty focused on medicine, but other hobbies that I had were surfing and cooking, and play a lot of basketball and volleyball. More recently, since I've been more busy, a wife and 2 kids, 1 daughter and 1 son. Hobbies have been cut back, but I still do a lot of cooking, and I started doing taekwondo. And those are my main hobbies now. I'm working out. If I wasn't an orthopedic surgeon and it wasn't something in the medical field, I'd probably be a chef. I think it goes back to I really like helping people, and if I'm able to preserve function, I'm able to get them back on their feet and doing their day-to-day activities, then I find that the most gratifying. So I think PIH Health is a good hospital because there are a lot of physicians here with a lot of expertise. They're very good physicians, caring physicians, and very good staff that are very good with patients and take the time to take care of all their needs.